We would like to introduce you to Dr. Elif Eren, who's been an expert in the field of aesthetic medicine for many years. Her areas of expertise include breast aesthetics, as well as aesthetic surgeries on body parts such as the abdomen, hips, and arms. Liposuction, vaginoplasty, and facial aesthetic surgery are also among her specialties. Oh, hello, Dr. Elif Eren.
Hello, welcome.
Thank you.
Dr. Elif Eren, may we ask you a few questions?
Of course.
Women often want breast enlargement either for medical reasons or for aesthetic purposes. Is this surgery very painful, and how long does the recovery take?
In breast augmentation surgery, the area where we place the implant affects how much pain the patient feels. When it's placed above the muscle, it's not very painful, but when we place it under the muscle, it's more painful because the muscle needs to be able to withstand the tension from the implant, and we're placing the implant on a flat surface. Except for my patients who are professional athletes, I prefer to place the implant under the muscle in about 98% of cases. With implants placed under the muscle, especially in the first 2 days, it tends to be a bit more painful. But even then, we can rate the pain level as about 6 or 7 out of 10. And with painkillers, the pain can be kept under control. After a breast implant surgery, it's enough for the patient to set aside about 5 days for recovery. The first 2 days of this period are more important from the surgeon's perspective. In the following days, the pain will gradually decrease and the patient will start to feel more comfortable. For example, after a week, the patient can drive a car.
Thank you. So, for example, what kind of indications are there for breast reduction surgery? Because you can both enlarge and reduce the breast, right?
Yes, for suitable patients, we enlarge the breast, and for those with large breasts, of course, we reduce them. And when we do a reduction, we also lift the breast at the same time. Sometimes the patient thinks her breasts are large, but in reality, they might just be sagging. Even though the criteria for breast reduction may seem purely aesthetic, since breast reduction surgery is often considered a cosmetic procedure, it is actually a functional surgery as well. Because when patients with large breasts come in for an examination, I can see a hump-like swelling on their upper back, like a camel's hump, or the marks from their bra straps become very pronounced. They can also develop rashes under the breasts or between them, and the patient's posture gradually starts to lean forward. So, after breast reduction surgery, patients will feel much more comfortable in these aspects as well. All of these are medical indicators. As plastic surgeons, when we do drawings or take measurements, we measure the distance from the middle of the collarbone to the nipple, the distance from the nipple to the inframammary fold, the width of the breast, and the width of the chest. We take all these measurements, make a plan accordingly, determine the appropriate technique, and then reduce and lift the breasts based on that.
Dr. Elif Eren, thank you for your detailed answer. May I ask one more thing?
Of course.
Is it possible to combine breast surgery with another operation? For example, with liposuction or a tummy tuck?
Yes, breast reduction or lift surgery can be combined with a tummy tuck or Vaser liposuction. What's important here is the patient's height and weight ratio. This is very important. I pay special attention to whether the patient has lost their excess weight. There's actually a type of cosmetic surgery we call post-pregnancy aesthetics, especially in women who have given birth more than once. There can be sagging in the breasts, sagging in the abdomen, and localized fat accumulation. For the majority of patients, I perform breast reduction, breast lift, tummy tuck, and 360-degree Vaser liposuction altogether. But of course, when doing this, I always follow safety criteria, pay attention to the patient's height and weight ratio, and if there are any risk factors, I make sure to evaluate them.
Thank you, doctor. This is very important for our patients.
Thank you. I'm glad you came.
Taking care of you is our top priority.
We can't wait to welcome you with open arms as our guests